Hello, I'm audiologist Dr. Michael Hill of the Hill Hear Better clinics in Cincinnati, Ohio. And I'm just worried that some of you guys might be out there and your hearing aid stops working, and with this COVID-19 you can't get out to get them repaired. So there's a few easy things that you can do with your hearing aids if they're not working. Number one, if you have one hearing aid that's not working and the other one is working, you can take the battery. You want to check the batteries. How long have they been in your hearing instrument? And if they've been in 5 days or longer, go ahead and change them. If not, say you have one hearing aid working and one hearing aid not, you can take the battery from the hearing aid that is working and put it in the one that's not working. And if it works, you know it's just the battery, so you can replace the batteries, and probably should replace them both at the same time. If it doesn't work, then there's other things that you should do. On most hearing aids, this is called a receiver in the canal hearing aid, and then we have a half shell or in the ear hearing aid, and usually they have a wax guard on them. And so what you can do is there's like a little rubber tip, or there could be an ear mold. If there's an ear mold, then this little white filter inside should be protruding, so you should be able to get to it. If not, then you can pull this little dome off. And inside the hearing aid, this is the receiver or the speaker, and there's a little speaker wire and everything. So you want to look inside there. I'm sure you can't see it very well, but it should be clear all the way down to the bottom. The filters are generally white, and what they do is they keep the wax from going down inside the speaker. And even if you can't see a lot of wax, you may want to change that first. And most companies are similar. This is a Starkey. These are Phonax, there's Resound, Oticon. They're all basically the same. So what you want to do is there's like a little, like old change purses where you pull these open. And I'm sure most of you guys have been instructed on how to do that, but during the fitting you go over so much it's hard to remember. But basically there's a nubbin end, and I call it a nubbin end, I don't know what else to call it, and that's the extraction end. So you simply place that inside the hearing aid, you push real hard and pull it out. And then the second thing you do is turn it around, and there's a brand new one, and just pop that one back in there, and hopefully you'll get a whistle. And this doesn't have a whole lot of power, so you can't hear it, but and it should be working. If it's not working, there's other things that you can do as well. Number one, if you have a battery operated hearing aid, you want to check you've already checked the batteries, so you want to check the little battery contacts, and I don't know if you'll be able to see those in there or not. This isn't a real high-tech setup here. But the next thing to do would be to take an alcohol pad, or if you have just the liquid alcohol, take a Q-tip, and then you put it down inside these contacts and simply clean them. They could be a little corroded, there could be moisture on them, you know, whatever, and clean them. And then just put the battery back in, and hopefully that'll work for you. If that doesn't do the job, then you probably need to contact your audiologist. And today, you know, with offices closed, we can't have new patients in, but we do check all of our voice messages. And so if you want to give us a call at 513-522-9936, if you have a problem, we'll call you back, hopefully the same day, maybe the next day, and we can walk you through it. If it's something that we can't handle over the telephone, then we'll have you mail it to us, and we'll send it in for repair and get it back to you. So everyone hang in there. We're going to get through this. Everything's going to be all right. And if you need us, we'll be here. All right. Well, be safe out there. Thank you. Goodbye.